Okay, let's talk about weightlifting posture and movement assessment. So, weightlifting posture first. So, what is posture? Well, it is an alignment or a position emergent from the individual, the environment, and the task. So, we talked about those constraints in our motor control lecture, and they very much relate to posture. So, posture is a position that depends on the individual and the environment and the task. So, with that, we hear a lot of false dichotomies: good versus bad posture, functional versus dysfunctional posture. Well, if we're saying that position depends on many factors, it's hard to make those dichotomies of good and bad, because you may say one posture affords performance in a certain task, but maybe that same posture affords not as good of a performance in a different task. So to make these dichotomies is not taking into account the many factors that are at hand. Neutral spine is more of a concept versus a true set point. And we say this because of the literature out. McKean did a study on the back squat that showed as soon as they unrack the bar with 50% of one rep max, they observed lumbar flexion, a measurable amount of lumbar flexion just from unracking the bar. And they also found that as the participants squatted down, their lumbar spines flexed the deeper they went. Eddington saw a similar thing in the squat and the deadlift. Upwards of 60 to 70+% of maximal lumbar flexion was seen as the lifters would squat down with 85% of their one rep max and would deadlift in the start position. Stuart McGill found a similar thing in the kettlebell swing at the bottom of the kettlebell swing, seeing upwards of 26 degrees of lumbar flexion, and Andrew Vygotsky saw the similar findings in the Good Morning. So what these findings tell us is that lumbar flexion and posterior pelvic tilt, these are coupled motions that happen naturally during similar tasks. So when we say neutral spine, well, we can't be talking about a set point because we're seeing movement, even when these participants are cued to maintain a stiff or steady posture. So another reason why the conversation of posture is nuanced. So on the left here, we see the clean and press, what we talked about in the weightlifting history lecture. Well, this posture, there was a reason for this. Essentially, they made the clean and press like a bench press because we can bench press more than we can strict press. And so this was a strategy to lift the most loads within the rules or constraints of the task and the sport. That was different when they took the clean and press out of the sport. Now that posture doesn't necessarily afford the same performance for something like the snatch and the clean and jerk as in the picture on the right. So different postures afford different performance outcomes. You can't say the posture on the left is bad because that was the posture that afforded the best performance during the clean and jerk. Now, of course, if we see a picture like on the left here, and we can probably see that hinging at the thoracolumbar junction there as she's lifting the weight overhead. Let's say this athlete came into the clinic and was experiencing sensitivity in that exact spot that we're seeing that thoracolumbar junction hinge as she goes overhead. And she says, yeah, I only experience my symptoms when I lift overhead. And then she creates a lumbar extension. We have her test lumbar extension, and that recreates the symptoms in the exact spot that we're seeing her move through in that picture there on the left. Sure, maybe that's time to intervene. Maybe we teach her a different movement solution or a different motor strategy to get that task done, to allow those tissues to desensitize a little bit. Maybe we change the variation so it distributes forces differently, something like that. So it's not to say that posture doesn't matter, and that has no correlation to what we see clinically, but it's just taking into account who we're talking about, if it's affecting their performance negatively, and if it's recreating symptoms or issues that they're having. We weigh all those factors and see if it's time to intervene. So another example here, if you look at the still shot, you might say, oh, that is an unsustainable posture even for performance, or that's a posture that may lend itself to sensitizing the facet joints into extreme extension, something like that. But this is a still shot that's taken out of context. So let's look at the context. So this is Max Lang. He's a German weightlifter. And you see he kind of hit his nose there, but this is a muscle snatch. So he is sending the bar upward with a pretty massive amount of force. And his spinal extension is kind of just a coupled motion with hip extension. And then he restacks himself as he presses overhead. So let's say the athlete was getting stuck in this position, though. So this was not an experienced athlete, and we were having them do muscle snatches, and they were getting into this position here, but they were getting stuck there. They were no longer able to continue the momentum of the bar and then restack their position to drive it overhead. Okay, in this case, certainly we may intervene, give them a different motor solution. Also, just lowering the load. Sometimes it's just too heavy, and their body can't adapt to the stress. So we've got these variables that we can manipulate. But case in point is we can't just say that posture was good or bad. It was a strategy that was useful for the task. Same athlete here during a push press. So again, a still shot taken out of context. We might say if an athlete is doing a press or a push press in this position and they're getting stuck in this position, we might intervene and teach them a different strategy, teach them to create a little bit more trunk stiffness, a little bit more stacked position, or if it was sensitizing symptoms that they were coming in for. But let's watch this video. A 160 kilo push press. We'll watch it again. Same athlete, 160 kilo push press. He's a 77 kilo athlete at the time before they changed the weight classes. So this is a pretty impressive lift. And you can see he's only in that extended position for a split second, and then he restacks himself onto the bar so that he can support the load. So again, if we just take a picture out of context and don't take into account how it affects the whole movement. So that was just an extension strategy. He extends his hips to drive the bar. The lumbar spine extends as a coupled motion, but then he restacks himself. So it's who are we talking about? Is it affecting their performance? Is it recreating issues that they're coming to us for if we're a clinician? So those are all the factors that we're taking into account. Now, posture can alter movement, and movement can alter posture. So position can alter movement, movement can alter position. What I mean by that, example one, posture can alter movement. Well, we see in this study by Ross in 2014 that anterior pelvic tilt can affect the end range, hip flexion, and internal rotation. So it was on average for every 10 degrees of anterior pelvic tilt, we'd lose 6 degrees of end range flexion and internal rotation. And then if you came to the clinical athlete weightlifting certification, you remember this is where I had you guys stand up, lift your right knee as high as you can, extend your spine, hyperextend your spine, lift your right knee again. And for a lot of you guys, you couldn't lift it as high. That pelvic tilt changed the orientation of the acetabulum. So the hip, the femur kind of butts up against end range a little sooner. Essentially, when you tilt the pelvis anteriorly, you are flexing the hip. So you're starting in more hip flexion. So it would make sense that you just don't have as much on the back end. This is neither good nor bad. It just is. So in the sport of powerlifting, where the standard is parallel for a squat, you don't have to bury it, and going any lower doesn't give you anything extra. You may use a harder arch strategy or more of an arch anterior pelvic tilt to cut your depth off. That may be a strategy that affords you the best performance in that sport. For a sport like weightlifting, where it's generally lowest lifter wins, where the bar is only going to go so high, the heavier and heavier it's loaded. If you can receive the bar in a lower position, that may afford you better performance. We might be cueing somebody to stack their pelvis and their rib cage a little bit more, as opposed to going into a hard arch strategy if that strategy is cutting their depth off prematurely. So you just have to tinker with that. So this is me, and this is in 2009. And that was my strategy. And I couldn't squat. I couldn't overhead squat any lower. I just felt a block, structural block. I wanted to squat lower. I wanted my squat to look like this, but I couldn't because of this position. It was locking down my hips. I was just hitting end range soon. I learned, it didn't take me 9 years, but over the course of time, I learned that if I stacked my hips under the bar a little bit more underneath my rib cage, I had more room in my hips to sit down. I just trained that, and I taught myself to do that over time. It just took practice. As I got stronger, that helped as well. So you see what the two lifts look like. And I wasn't trying to power snatch in 2009. That was just my bottom position. And it's not like my bony morphology, somehow changed, or I got hip replacements or something like that. I just learned how to coordinate my body into a position that afforded me the best performance. And with a lot more weight, but that's just a training thing. Just keep coming to the gym, you lift more weight. Okay, example number 2. So we just talked about how posture can alter movement. Well, we also see that movement can alter posture. And in this study, they took male athletes and they simply had them raise their arms over their head. They had them flex their shoulders. And what they found was as they flexed their shoulders, their thoracic spines naturally extended, on average about 13 degrees, which isn't that much, but it was significant enough to be observed and measured. So what this tells us is that shoulder flexion drives thoracic spine extension. It's a coupled motion, very similar to how we talked about hip flexion and posterior pelvic tilt are coupled motions. In sprint research, we see that hip extension is coupled with lumbar extension just kind of naturally. So we see a similar thing in the upper body. Shoulder flexion, thoracic spine extension are coupled motions. So if we're thinking about thoracic spine extension in a front squat, we want somebody to try to maintain a taller upper back. We can cue elbows up because that is shoulder flexion, and that will naturally drive thoracic spine extension. So you see the angle opens up here as the participant flexes their shoulders. So let's talk about a factor or factors that influence position, or AKA posture. Intra-abdominal pressure seems to be one. What is intra-abdominal pressure? Well, it's literally the pressure between your respiratory diaphragm and your pelvic diaphragm or your pelvic floor. And that's measured by transducers that are down to the mouth or up through the, and it measures pressure in that area. And what does that do? Well, it seems to aid in spinal stiffness or trunk stiffness, which is our relative ability to maintain a position under load. And we see that intra-abdominal pressure is modulated by breathing and muscle contraction. So intra-abdominal pressure increases when we breathe in. So in inspiratory conditions, when we're holding a breath in or breathing in, and the pressure seems to decrease when we breathe out or in expiratory conditions, which makes sense. Another interesting thing about intra-abdominal pressure and breathing associated with it is that it seems to self-modulate based on the stress. It increases as lifting effort increases naturally. So as you exert more, your intra-abdominal pressure increases without you thinking about it. It also increases during faster lifts versus slower ones. So the speed of the movement or the stress or the effort, the rate, affects the intra-abdominal pressure. Your body will modulate more pressure faster to accommodate. It's timed in relation to the external torque. So in some studies, they surprise the people in the study with some type of stress. So maybe it's somebody who's falling and you have to catch them without expecting that coming. And the body times intra-abdominal pressure with the thing. So it modulates fast enough that we don't have to think about it. It just accommodates the movement. And we breathe in to accommodate larger loads. So the heavier the load, the more we breathe in without even thinking about it. So you can think about that during a back squat. You take in more air as the weight gets heavier. Do that naturally. As the intra-abdominal pressure increases with lifting effort, we've established, but we also breathe out less as the lifting effort increases. So we naturally expel less air or we hold in more air the heavier the load, which also makes sense. Think about a back squat. As the weight gets heavier, we kind of naturally hold our air more as opposed to exhaling as we stand up. As opposed with lighter weights, you might actually be just maintaining more of a normal breathing pattern, exhaling a little bit more because that loss of intra-abdominal pressure is no big deal because the weight is lighter. So all of these things self-modulate. This is all happening without us having to think about breathing more or creating more pressure or holding our air, not exhaling as much. Our body kind of takes care of it. Can we still cue these things and coach them on top of what our body self-modulates? Yes, absolutely. But just know that it's not required per se. We can just let the appropriate prescription of load take our body to what it's naturally going to do. And a couple interesting points here. The degree to which the body self-modulates intra-abdominal pressure seems to be dependent on the training age. So in male athletes, trained male athletes who used a lower percentage of their max intra-abdominal pressure than untrained male athletes at the same relative intensity. So meaning untrained athletes they were creating maybe an extra amount of pressure. So they weren't modulating quite as accurately based on the stressors, whereas experienced athletes, their bodies created enough intra-abdominal pressure for the stress at hand, but not extra. So they used as much as they needed. And saw similar findings in one study between males and females. Now, this is just one study, and it's probably not enough sample to even speak of, but in a lot of research, females have been shown to have more range of motion just in general. And so perhaps females need to create an extra degree of intra-abdominal pressure to accommodate that potential extra range of motion to control those positions. But again, I'm speculating there. Would need to see more literature on that to know for sure. But intra-abdominal pressure, so we've established that it self-modulates based on the stress. Now, what does that mean for performance? Well, the direct effects are not super clear, but it does seem to have something to do with hip extension, performance, and torque. So in this study here, as the participants increased intra-abdominal pressure with an inspiratory hold, so as they held their breath in and created pressure, their hip extension torque went up. So they're able to create more rotational force through the hip versus when they would breathe out and then hold. So increased intra-abdominal pressure seemed to help with increasing your hip extension torque. We saw a similar thing in this study where during a maximal RDL, the body increased its intra-abdominal pressure during the concentric portion, which is the up portion or the hip extension portion versus the lowering portion. So intra-abdominal pressure actually decreased on the way down. So this just kind of confirms that intra-abdominal pressure and hip extension kind of seem to be coupled there, where hip extension is kind of that big driver of a lot of these movements, and intra-abdominal pressure seems to help with that. The mechanism's not super clear there, but it makes sense if you think about just creating a solid platform through the trunk. Now the hip has a stable base to drive off of. It can leverage that pressure and transmit that force from hip extension into our trunk, into whatever movement that we're doing. What's interesting is it doesn't seem to have that same effect for hip flexion. So creating pressure, wearing a belt doesn't seem to help driving your knee up, let's say in a sprint or something like that, or on the way down during a hip hinge or a squat. So it seems to be that hip extension driving forward, that propulsion that intra-abdominal pressure plays a role in. So now we talk about weightlifting belts. So what do weightlifting belts do? Well, the main thing is they increase intra-abdominal pressure and subsequently spinal stiffness. So what does that do in regards to translating to performance when you wear a belt? That seems to, in this study, participants increased their speed, or they were able to finish a set of 8 faster than the group who didn't wear a belt. So at moderate loads, 75 to 80%, you have a set of 8. You're able to cycle through the reps a little faster if you have a belt. on average. And so what would that translate to? Well, perhaps you could just do more volume that way, accumulate less fatigue, get your reps in. They're a little faster, they're a little easier. Maybe you get an extra set in. And so over time, you're just doing more work. They allow for faster singles at heavier loads. So groups that wear a belt at 90% or just heavy loads seem to be able to move through those singles faster. The bar velocity is higher versus the group who's not wearing a belt on average. And going back to the slide before, if we know that intra-abdominal pressure seems to aid in hip extension torque, it would make sense that when you strap a belt on, you increase intra-abdominal pressure, you're able to drive out of the bottom of the squat with a little bit more hip extension torque. So that would increase the bar velocity. Same thing in deadlifts. Increased rate of force development off the floor, which is that hip extension moment. Wearing a belt. Decreased perception of effort with groups that wear belts versus not on average. So the belt does seem to give you a little bit of juice, or for a lot of lifters, give you a little bit extra from a performance standpoint. But what doesn't the belt do? Well, it doesn't seem to make your core weak. And the reason that we say this is because there's a fair bit of evidence on EMG studies wearing a belt. So they'll put EMG on different abdominal muscles, and the evidence is just real inconsistent. Some studies during a squat, it's this abdominal muscles decreased EMG with the belt, but this abdominal muscles increase. And then the deadlift, it's vice versa. And then some studies, it's vice versa, same movement. So the evidence is so inconsistent, and there's no studies that I know of that show all of your abdominal muscles activities are decreased wearing a belt during a certain movement, where the belt just seems to make the abdominal muscles silent. I've not seen anything like that. So there's really no reason to believe that wearing a belt would make your core weak, or it would somehow make you use your core less, so that you just didn't, if you take the belt off, now you don't have abdominal strength. There's no evidence to support that right now. It also doesn't decrease injury risk. And most of this evidence comes from work studies. So occupational studies where they're wearing lumbar supports and things like that. And it doesn't seem to decrease risk. Or decrease injury rate either. Even though if you poll gym goers at 24 or wherever, most of them are going to say that they wear a belt for safety reasons, even though there's no evidence to support that. So if you think about the logic, if you look up here, it seems to me that the belt's an overload tool. So if we are overloading, we are by definition exposing ourselves to more stress. So that would expose us to more risk just inherently. So the belt, if anything, it exposes us to more risk because we're able to train harder and overload. So even then, just the logic doesn't seem to hold up that it would decrease injury risk. Bottom line is, if you want to wear a belt, if you feel like it helps, go for it. I'm not sure there's any benefit to wearing a belt below, say, 70%. I haven't seen much evidence that shows that you get any performance benefit from that. So if you're working at lighter loads, or you're doing more hypertrophy training, something like that, you probably don't need a belt. If you just don't like the belt, if it's not comfortable for you, you don't like the way it feels, whatever, there's no rule here. So it's just an option. And for some athletes, it helps them maximize their performance if that's the goal. Now, how much of these numbers are placebo? I mean, it's not like these are blinded. The athletes who were wearing a belt in this study, they knew they were wearing a belt. So there was no placebo control. So how much of this is placebo could be a fair bit. We don't know. We haven't teased that out. And down here, obviously, if there's some type of, for our healthcare providers and coaches too, if your athlete that you're working with has blood pressure, is on blood pressure medication, or has history of high blood pressure, or some type of cardiovascular issue, something like that, history of getting dizzy, lightheaded during strenuous activity, don't strap a belt on them. It's real easy. Just ask them, make sure that you've cleared that history. All right. So what is the optimal ratio of pelvic tilt and thoracic extension and intra-abdominal pressure, breathing in, forcing an ab contraction, all of those things? Let's find that ratio to be like this guy and win a world championship. Well, the answer is we don't know. So as we know, Optimal, sustainable positions for the individual lifter will emerge through the motor skill acquisition process. So if we are deliberately practicing our variations, and as coaches, we are providing the variations that challenge the athlete, but also are within their capabilities, then these positions and these other things tend to play out. They tend to self-organize, and the athlete tends to figure it out on their own, especially with a progressive loading over time. The heavier it is, the body will kind of self-regulate. If it's too much increase, that's where things go awry. So, and it seems like common sense, but that's what people do, I think, is they load too fast, too soon. And we could be talking about in the session, just taking too big of jumps, and all of a sudden things fall off, the wheels fall off the wagon, and they can't just work on that thing. There's too much stress. You have to pull way back. And you see that over the course of training as well. Too much progression too soon across days or weeks, where all of a sudden they hit that ceiling, or they surpass that ceiling, and they're no longer learning anything. So that's where in coaching, we're subtly cueing and course correcting with these things. The body tends to learn. Okay, so this is the next progression here, and take a break. We'll see you soon.